Hello, everyone. Today, I want to update you on all on three key elements of our fight against COVID-19: modeling, testing, and vaccines. Let me start with modeling. This morning, Dr. Tam and Dr. New presented new models that show the potential spread of the virus over the next few weeks. The reality is that right now, hospitalizations are still on the rise in many provinces. We need to keep reducing in-person way to get these numbers down. Since overwhelmed, deciding who gets an ICU bed and who doesn't, well, that's not where we want to be. So please, keep following public health guidelines and stay safe. In
Quebec as well, it's very important for people to continue to follow public health directives and measures to decrease the number of cases and hospitalization rates. As you know, the pandemic has impacts going way beyond just those who test positive. When hospitals are overwhelmed, we all suffer. We all learned a new word, offloading. That means thousands of surgeries that are being put off. There's also the fact that monitoring cannot be done for cancer, for example, putting more lives at risk, and healthcare providers are exhausted from having to make so many difficult decisions. I know that we are tired and that the measures are strict, but while we continue to vaccinate those who are most vulnerable, we absolutely need to flatten this wave, the second wave. From the very beginning, our response to the pandemic has been based on science and the best data possible. However, on Wednesday, during the virtual cabinet meeting, different experts came to give us information, including Dr. Tam, Dr. Niemer, the president of the Public Health Agency of Canada, and the two vice presidents, or co-presidents rather, on the working group on vaccinations and the vaccination roundtable. This morning, the expert panel on testing and so on was published. First, I'd like to thank the two co-presidents, Sue Page and Dr. Irfan Dalla, as well as all of the members of the committee. Since the fall, we have distributed more than 14 million rapid test kits to the provinces and territories. The committee's report this morning makes recommendations on how to best use these rapid test kits in an optimal manner. High-risk areas and centres such as schools and long-term care centres is very important.
The expert advisory panel published their first report this morning. In it, they laid out evidence-informed advice on science and policy for COVID-19 testing and screening. The panel has identified 4 priority areas of action to reduce the spread of the virus, protect Canada's most vulnerable, and limit the impact of the disease on the healthcare system and on the economy. So far, we've sent more than 14 million rapid tests to the provinces and territories, with more on the way. Effective testing and screening is key to stopping COVID-19 transmission and limiting outbreaks in long-term care settings, schools, workplaces, and other high-risk locales. We all have to work together to use these rapid tests to slow the spread of the virus. Today, I also want to talk about where we are with vaccines. On Tuesday, I announced that we reached an agreement with Pfizer to buy an additional 20 million doses of their vaccine. Yesterday, Major General Fortin confirmed that as of today, almost 1 million vaccine doses have been delivered to the provinces and territories. We're working day in and day out to get vaccines delivered as quickly as possible. Shipments have largely been ahead of schedule so far, but with an undertaking this historic, it's only to be expected that there will be a few bumps along the way. Earlier this morning, Minister Anand talked about her conversation with Pfizer Canada regarding impacts to vaccine production. Due to work to expand one of the company's manufacturing facilities, deliveries to all countries receiving Pfizer doses made at the European facility will be temporarily reduced, and this includes Canada. I want to be very clear. This does not impact our goal to have enough vaccines available by September for every Canadian who wants one. It will also not change our second quarter goals. Canada must still get ready for the ramp-up phase in Q2. This kind of issue is out of our hands, and that's why we pursued an aggressive procurement strategy in the first place. Canada has one of the most diverse vaccine portfolios in the world, and we secured the largest number of doses per capita of any country. We have 7 bilateral agreements to ensure flexibility when it comes to supply chains. And like I said, this situation with Pfizer is temporary. This
week alone, we have delivered 380,000 doses of the vaccine to the provinces and territories, and deliveries are ongoing. We are doing everything in our power to get as many doses of vaccines as possible, as quickly as possible. And through this process, it's only to be expected that there will be a few bumps along the way. Earlier this morning, Minister Anand talked about the fact that there will be a delay in receiving vaccines due to work on the European facility, Pfizer's European facility, and deliveries to all countries will be delayed. This includes Canada, but I want to be very clear, this does not impact our goal to have enough vaccines available by September for every Canadian who wants one. It will also not change our second quarter goals. This is out of our control. However, we have to remember that this is why we have made sure, Canada has made sure to have as many doses as possible reserved for each person who wants one. And our aggressive procurement strategy means that we do have some flexibility in our procurement chain, and you will all be able to get the vaccine by September.
But no matter how much longer this crisis lasts, no matter where you live, we've got your back. Yesterday, a request for additional support was approved by the federal government for Nain in Newfoundland and Labrador. The Canadian Rangers will help with the vaccination effort, as many vulnerable and elderly people in the community need help getting to and from the vaccination site. In Ontario, we approved an extension for the Canadian Red Cross until March 31st to continue supporting isolation and recovery centres for temporary foreign workers in the Windsor-Essex region. And in Manitoba, an extension has also been approved so that the Canadian Red Cross can provide general support as well as support to personal care homes until March 31st. Far too many families are facing the heartbreaking realities of what's happening in care homes across the country. This is a crisis we all need to work together on. And as we have from the very beginning, the federal government will always be there when it's needed most. Before I wrap it up for today, I also want to take a minute to talk about housing. With rising homelessness and housing needs, the COVID-19 crisis has made it clear that affordable housing will be key to Canada's recovery. Everyone deserves a safe and affordable place to call home. In September, we announced an investment of $1 billion through the Rapid Housing Initiative. Today, we can announce the details of the over $203 million that was allocated for Toronto. The city will be starting 7 projects to create more than 500 new affordable homes. These will be prioritized for people experiencing homelessness. Of the total number of new homes, 20% will also be prioritized for Indigenous communities and 20% for women and girls. That takes us to nearly half of the new units that will go to people who are especially vulnerable when it comes to housing.
Earlier this week, Minister Hussein also announced additional federal investments of nearly $40 million to increase and further spread the emergency measures in order to help people experiencing homelessness in Quebec. This additional funding comes from the funding we announced in September as part of the Reaching Home initiative. COVID-19 has had serious impacts on people experiencing homelessness who must deal with the cold and so many other problems. Each Canadian deserves a safe and affordable housing situation, and we will continue to work together to build an inclusive Canada that leaves nobody behind. And
On va bâtir un monde
together,
meilleur.
we will build a better world. Thank you very much.
Thank you, Prime Minister. We'll now go to the phones for media. One question, one follow-up. Over to you, operator.
Thank you, merci. La première question, the first question is from David Youngren, Reuters. Please go ahead. Your line is open.
Yes, good morning, Prime Minister. Is your government going to get involved in the bid by the Canadian firm Couche-Tard for France's Carrefour?
Our role as a government is always to be there to support Canadian companies, including as they look to expand around the world. I know that discussions continue to be ongoing, and I won't make any further comments on that.
Follow-up, David?
Okay, because my next question was, do you think the deal is dead, given the resistance in France?
I had a conversation earlier this week with President Macron in which we talked about the need to work together on a broad range of things, from COVID-19 to economic opportunities for our citizens as we engage cooperatively in a global world. I continue to be confident about the ability of Canadian companies to succeed everywhere around the world, and we'll continue to work to ensure that that happens.
Thank you. Next question, operator.
Merci, thank you. The next question is from Lucas Meyer, News Talk 1010. Please go ahead.
Thank you very much. Good morning, Prime Minister. Prime Minister, you just kind of gave the green light, if you will, on Ontario's stay-at-home order, saying it's the type of tough measure that's in place. But I'm curious that with Ontario doing what it's doing, Quebec going with the curfew, and kind of different measures around the province, with the surge in the numbers that we just saw this morning, are you considering at all some sort of short-term, more national approach or implementation, a national form of restrictions and lockdowns? Are you very confident that the provinces should just be in complete control of themselves?
As we've seen from the beginning, the course of this virus is very different from one region to another. What is right for Nunavut may not be right for Prince Edward Island, may not be right for British Columbia. And that's why our role as a federal government is to be there to support the provinces and territories through the very difficult decisions they need to take. That's been why we've been there to have Canadians' backs on supports for small businesses, on supports for families, for seniors, for students. We're going to continue to be there to support the provinces and make those incredibly difficult decisions around restrictions slightly easier by ensuring that everyone knows we have their backs. But again, because this is such a disease and a virus spread with different faces and different stories in different parts of the country, we know that provinces are best suited to determine what is the right path for them.
Since the very beginning, we have been there as the federal government to support the provinces in making difficult decisions that they have had to make. We know that this virus has different characteristics, leads to different results throughout the country. In the way it spreads as well, it is different. Each province is best placed to make the right decisions within their jurisdiction as to measures to take. But to support the provinces in making these difficult decisions, we are there, and that's why we are making the promise to be there to continue to support all Canadians. We will continue to be there with support for all families, small and medium-sized enterprises, seniors, students. We will continue to be there to support Canadians and allow the provinces to make the decisions they need to make.
Yes, thank you. Prime Minister, on that, do you have any, for Ontario and Quebec specifically, because they're right next door to each other and they have these, one has the curfew, one has the stay-at-home order. Are you concerned at all about just citizens, looking across the border and seeing all of these different rules and any potential confusion, any frustration that Canadians might have for those two provinces specifically?
I think over the past 11 months, Canadians have grown used to looking at what their local public health office official recommendations are about understanding that the course of the virus is different in different parts of the country and indeed in different parts of the world. We have learned lessons about what works here, what doesn't work there, and the public health officials in every region are making the best possible decisions they can that are suitable to their their citizens. So yes, of course, we're going to look at what other people are doing, but it's really important that everyone follow the local public health recommendations.
Merci. Prochaine question. Operator.
Thank you, merci. La question suivante est de Boris Proulx. Le Devoir. La parole est à vous.
Bonjour, Monsieur le Premier ministre.
Good morning, Prime Minister. My question is regarding international travelers. Of course, you discourage people from traveling internationally, but to really discourage people concretely, is the federal government looking at measures that were imposed in other countries? There are mandatory quarantines, for example, in New Zealand and elsewhere, upon return or arrival and so on. Since March, we have had very strong measures such as quarantines with very strict and high fines, and there are measures that we enforce for people who have to quarantine. Our recommendation continues to be not to travel. That is the best way to protect ourselves, to protect yourselves, the healthcare system, our healthcare workers, our seniors, and our families. People should not be traveling. In addition to the quarantine measures that we are currently strengthening, we have also added rules regarding testing prior to returning to Canada. That is an additional measure to protect us, and we will continue to look at all the measures, both to discourage travel and to ensure that the current measures are the right ones to protect Canadians.
From the very beginning, we brought in extremely strong measures on a 2-week quarantine that is stronger than most of our allies and has been extraordinarily effective over the past many months at keeping Canadians safe from international spread of the virus. But of course, we need to continue to strengthen those measures. We strengthened the quarantine penalties and fines and the follow-ups to make sure that people are actually quarantining. We've also brought in new measures around pre-boarding testing before people return to Canada as an extra measure of safety. And of course, at the same time, we continue to tell people not to travel. We are actively discouraging any form of international travel. That is the best way we're going to make sure we're keeping Canadians safe, not just from the virus, but from all the new variants we're beginning to see elsewhere around the world that we need to keep Canadians safe from. We're going to continue to work to make sure we're keeping Canadians safe with whatever measures necessary.
And a follow-up question. We heard from the public health experts encouraging strong public health measures to combat the spike in new cases. I was asking if during your meetings with the experts, as you mentioned earlier, if some expressed any preferences to various measures, for example, Quebec's approach or Ontario's approach and so on. Answer, Dr. Tam and Dr. New continue to highlight the fact that what's important is to reduce contacts in our lives. Stay home, have a curfew, limit travel, limit gatherings. All of those are measures that will lead to reducing contacts. Each person, each and every one of us should think about what we can do to reduce our contacts as much as possible. Obviously, we all need to follow local health measures. The goal to reduce contacts is one that is there across the country.
Morning, Prime Minister. Glenn McGregor, CTV News. Last time we were here, you said Canada in Q2 would receive enough doses to vaccinate 20 million people. Later that day, the Procurement Minister said Canada would receive 20 million doses. You know, those are not the same things. Did you misspeak then? And if not, are you still expecting to be able to vaccinate that many people and receive that many doses in Q2, given what we're hearing about Pfizer today?
We've seen the challenges that Pfizer's facing, and it's important that Canadians be informed of these challenges as they come up. But as we've said, it looks like it's only a delay. But of course, this is part of the reason why Canada reached out to so many different potential vaccine manufacturers and secured a broad array suppliers for vaccines and secured more doses per person than just about any other country. This is a challenge, but we knew these types of challenges would happen with a global effort like this, and that's why we've made sure to ensure that we have a varied approach, because as always, diversity is a good rule of thumb to follow. We know that we're looking to receive more doses from different companies as they get approved as well. This is all part of how we're going to ensure that all Canadians get vaccinated by September.
I think it's extremely important to highlight the fact, and that Canadians understand the fact that, yes, we are facing challenges in terms of the production and distribution of vaccines across the world, but that's something we could expect. I mean, these are new massive vaccine production lines. It's normal that some companies will see challenges. That's why we ensured that we had agreements in place with many different drug makers and vaccine producers, and we have secured the most number of doses per capita of any other country than any other countries, and we will do everything we can to speed up the distribution of vaccines. And I can assure Canadians that we are maintaining our target of vaccinating everybody who wishes to receive the vaccine by the end of September.
I wonder if you could explain to Canadians this. If there's too many kids on an outdoor rink, bylaw can issue them fines. If somebody gets in a car and drives to the land border because they want to go shopping in an outlet mall, they get turned back. But if you want to jump on a plane and go to an all-inclusive in Jamaica, go right ahead. Explain that to Canadians. Why is that still okay?
Obviously, there are rules in different parts of the country that apply differently. And different jurisdictions will set up the rules that they think are best based on the best advice of their public health officials. On the federal side, we have strongly discouraged non-essential international travel, including by imposing mandatory quarantines for anyone returning to Canada, and now mandatory testing for anyone before they get on a plane to come back to Canada. These are measures that are limiting, as we're seeing the airlines reduce their flights because people are understanding that they are not supposed to travel right now. On top of that, with the concerns people are seeing around different variants popping up around the world, there is even more importance in keeping Canada safe from the arrival of new strains of this virus. That's why we're going to continue to ensure that these measures at the border and on flights are stringent and applied and continue to discourage people from traveling.
Hi, Prime Minister. Tom Perry, CBC. You talked in your remarks about possibly banning certain flights. I'm wondering if you can offer any more detail on that. Does it be to places where there's new strains, where there's been outbreaks? And would you be open to the idea of a ban on travel, or would that withstand a charter challenge?
As we said from the very beginning, we will do whatever it takes to keep Canadians safe based on the best advice and the best recommendations of experts, as we did when there was concern over the Christmas holidays around the UK variant. We banned flights outright coming from the UK while we could bring in stronger measures around pre-boarding testing. Mandatory for anyone returning to this country. We will continue to look at various variants, various geographies, and make sure we're taking the right decisions and the right measures to keep Canadians safe. Every step of the way, we're going to be informed by the recommendations of our experts and of public health doctors on how to ensure we're keeping Canadians as safe as we possibly can.
Total ban, though? Would you look at something like that?
We're always looking at various measures as they are effective elsewhere in the world. But so far the measures that we have taken in place, the extremely strong mandatory quarantine that's been in place since March and has been extraordinarily effective, even as we've seen cases rise from external transition throughout Europe and elsewhere. Our measures have been very strong, but we're always open to strengthening them as necessary.
Answer. We have extremely strong measures to protect Canadians. From the very beginning, there's the mandatory quarantine that has been very effective in preventing the virus from arriving on our shores from elsewhere. But we will always continue to look at what else we can do that will be effective to protect Canadians. Question from Radio-Canada. Now, looking at the projections that we saw today, it's pretty worrisome. Would it not be the time to look at new measures in addition to curfew, a stay-at-home order like we saw in Ontario? Should we be going further? I'm asking the question because, for example, in British Columbia, they want to have a bubble like they had in the Atlantic provinces. Do you think that's a good idea? Answer. I think that each province and territory need to make the decisions that are right for them. Of course, we will be there to support them. We saw that with the Atlantic bubble, they didn't need to ask for the federal government's permission to go ahead with that bubble. It's the same thing for the territories, which have had their own bubble since the very beginning. I think each jurisdiction across the country must make its own decisions. And as I've said from the very beginning, the federal government will be there to support the provinces, to help Canadians throughout the country with support to replace lost revenue or income, to support their businesses. We want to make sure that once the pandemic is done, we can come back as quickly as possible to a prosperous economy and a more normal life. Question. Another question regarding what Mr. Blanchet, the leader of the Bloc Québécois, said regarding transportation. He said, and he wrote yesterday, that he had raised important questions during the democratic process, but that the Prime Minister is preventing those questions from being answered. What would you respond to that? Answer. I was so surprised to see the unacceptable statements from Mr. Blanchet, especially after the week we saw in the United States, where insinuations and the fact that people try to bend the facts, misinformation, encouraging hate and intolerance by very innocent words that mean nothing. But I mean, come on, this hidden intolerance, this encouragement, this incitement to be suspicious about everything, that is not welcome in Canada, and it's shameful that the leader of the Bloc Québécois said that.
To see a federal party leader use insinuations and carefully coded questions, particularly this week when we just lived through last week, what happens when leaders don't take care of the words they do and play these dangerous games around intolerance and hate. And of course, stand there innocently and say, oh, I was just asking questions. That's ridiculous. That kind of political pandering to the worst elements and to fears and anxieties has no place in Canada, and all of us need to stand up strongly to push back against that anywhere it happens in this country.
I could just ask a quick follow-up on the border for a bit more clarity. Why is the land border so tightly restricted, but airspace, for lack of a better word, is not? Why can people still get on airplanes and fly in and out of this country, but they can't drive?
Arrival in a different country is managed by that other country. For example, Canadians can't drive into the United States and Americans can't drive into Canada. That's Americans not driving into Canada or flying into Canada is a decision that the Canadian government took. The American government took a position on land borders that they haven't taken in terms of air travel. That is their decision. Our decision as Canadians is to make sure that we are consistent and strong in our regulations on travel. Merci tout le monde.
Thank you, everyone.